Hello, everyone. My name is Debbie Khalil from USAID's Office of HIV/AIDS in Washington, D.C. Good morning and good afternoon. Welcome to our USAID Government to Government webinar series for government counterparts. We are so excited to have you here today. This is the first in our series of 5. And we hope you will enjoy this one and continue to participate in our future webinars. We are so honored to have government colleagues from many of our countries where we have government-to-government agreements. Also welcome our USAID colleagues from our USAID missions around the globe and Washington, D.C. We have on many experts in government-to-government agreement with lots of experience in implementation, as well as those who are really new to a government-to-government agreement. We hope that everyone will have active engagement and participation. Please feel free to put in the question and answer box your experiences, observations, and questions you may have along the way. Today, we're going to go through this presentation. You see the outline here, and we will have a little background and then talk about the process. We are very thrilled to have on the line government representatives from Zambia and Uganda to also share some of their experience with design and implementation. We will virtually visit the health regional referral hospital in Mbara, Uganda, and Zoom to the district health office in the Copperbelt province of Zambia. At the end, we hope we'll have some time for questions and answers. I wanted to say also why our Office of HIV/AIDS is hosting this. We have a growing number of government-to-government agreements in our PEPFAR HIV portfolio, and we see this as a critical piece for our PEPFAR USAID work going forward. So we are really thrilled to have a chance for everyone to share lessons across countries and learn from each other. On the webinar procedure, this webinar will be recorded. The presentation and the recording will be emailed out to everyone afterwards. It's also saved on our implementing partner IntraHealth's ASAP website. And thank you to ASAP for supporting our hosting of this webinar series. If you would like to speak, you can unmute yourself and by letting us know, raise your hand, which is a little icon on the bottom of your screen, and we will unmute you from our side to allow for speaking. Please use the question and answer box for any particular questions. We will try to answer those as we go or live. And at the end, we will also send out written responses to all the questions so you have those for your records. At the very end of the webinar, there'll be a short poll, just 3 quick questions. Hopefully you can give us some feedback so we know how to tailor these future webinars to be best for your engagement. So without further ado, I'm going to turn it over to our Office Director of the Office of HIV and AIDS in Washington, D.C., Clint Kavanaugh.
Thanks, Debbie, and good morning, good afternoon, everyone from a rainy Washington, D.C. I hope you, your families, and your teams are remaining well. As Debbie said, this is the first session of what will be a series of USAID PEPFAR government-to-government webinar series, and it's our first time as an office, and really as USAID as a whole, to offer this government-to-government webinar series that are really targeted to our partner government counterparts. I really, as Debbie said, want to extend a special welcome to our esteemed colleagues from the governments of Ghana, Zambia, Uganda, Namibia, Mozambique, South Africa, as well as our USAID staff in the field and at headquarters. As Debbie said, we have a growing portfolio of government-to-government relationships and mechanisms across our USAID PEPFAR portfolio. And it's exciting to see not just the growth that's really been facilitated by revised policies within USAID, but also the ways in which they're being set up, both at the central level and at the subnational level. And we'll hear from experiences from countries on this call. Exciting to see G2Gs being set up at the provincial level. We have other countries that we'll be talking to. Kenya's doing quite a bit of work at the county level in G2G. So there are a number of different intersection points with government, as well as different areas of our portfolios that are being channeled through these mechanisms. So it'll, as Debbie said, be exciting to hear from one another how we're using G2G, which in a way that as we move into the sustained epidemic control era of PEPFAR, we really see G2G as being critical to helping maintain and sustain the incredible achievements that we've made in PEPFAR. We hope these sessions will be helpful for you, whether you're new to government or G2G as we say, or have been supporting a G2G for quite some time. Again, we look forward to learning directly from you. I cannot tell you how much we are able to modify our approaches to government agreements based on the inputs that we receive from you. Ultimately, this is an opportunity for us to share across countries and again, learn from each other. We see these agreements as critical to support the sustained response effort, but there are opportunities as we get these mechanisms in place to look at how we can continue to evolve and optimize programming through the mechanisms. And again, helpful to hear from you what your vision is on that. We aim to transition USAID engagement from a traditional donor implementing partner role to a foreign assistance investor, which recognizes the role of government in country development and the importance of strengthening systems for long-term sustainability. This session will really be an overview of the process, and we look forward to more detailed sessions over the next few months as we get into more of the specifics around implementation. Please engage actively in the chat with your questions, observations, and share your experiences. We really do want this to be a two-way conversation. And so I really want to thank you again for your participation, looking forward to the session. And again, looking forward to this being a series of conversations that we have with you, your teams, and again, create these fora for sharing experiences. So welcome, and Debbie, over to you.
Thanks, Clint. So we're going to talk through quickly some background and then jump into the steps. We wanted to make sure everyone understood when we talk about government to government agreements, or as Clint noted, we call often G2G, that everyone understood what we were referring to. USAID as an agency in every country we work, connect with government, work every day with government, share and collaborate. But G2G, or government to government assistance, refers to a really unique mechanism and approach that we have to disperse funds directly to a partner government, with money going through a partner government's own financial management, procurement, and other systems. So this is a unique way that we work in a handful of countries around the world. Next slide. And just to give you a snapshot of some of the countries where we have government to government agreements. This is a look at just between the period of October 2019 to December 2020. You can see the range of countries where we have government to government obligations happening. This may not represent every government to government agreement that is active, but it gives you a sense of some of the countries where we're operating. You can see at the bottom that this portfolio represented $2.7 billion of funds in that period of time. And I wanted to note that some of the government to government agreements have very small amounts. They start off sometimes as pilots with under $100,000, going through the systems to test it out, make sure the programming is being delivered, the funds are flowing properly, and then they scale up. That is the case in many of our countries. And then we have other government to government agreements that have been operating for a long time and have lots of money flowing through them to deliver almost our whole USAID portfolio through an agreement, a government to government agreement. Next slide. So why would USAID want to do a government to government agreement, and why would partner governments want to do this with USAID? We've listed out some of the reasons here, but just to highlight that this we see for USAID helps strengthen our relationships between countries, governments. It also helps achieve our joint programmatic results. It can strengthen the national and financial systems, national health and financial systems, and supports long-term sustainability. For a partner government, all of the above reasons hold true, but additionally, that a government to government agreement helps provide direct financial support for health services for a country. The money is on budget and transparent funding. And this also helps support a more coordinated approach across donors and ensures alignment with national programs and priorities. Next slide. And why is this important for PEPFAR? Clint already highlighted this, but PEPFAR is moving into a phase of sustained epidemic control where we really see we need to work on the long-term sustainability of the response. So it is critical for us to continue to strengthen our partnerships with host country governments and make sure there is clear alignment with our PEPFAR contributions and the national priorities and investments. In our latest COP or country operational plan guidance for this year, there's a big emphasis on government to government agreements and the critical role that mechanism provides for sustainability of our HIV response. We wanted to show, give people an idea of what could be in our government to government agreements for HIV. These, again, as Clint noted, can be at any level, at the national level, subnational level, or other. We've seen a lot of different ways countries have partnered with government partners. In terms of services, we obviously have a range of HIV programming and services across the clinical cascade and prevention programming. Many of our government to government agreements also combine HIV money with tuberculosis funds we have, or malaria funds, maternal and child health funding, other infectious disease money, including COVID funding, to create a kind of integrated health portfolio through our G2G or government to government agreement. In all of our government to government agreements, there is also a big capacity building component, and that includes strengthening the public financial management systems, data systems, other kinds of technical capacity, procurement, human resource systems, among others. So the G2G really spans types of programming that's both direct service delivery, but also system strengthening. Next slide. Here's just a snapshot of some of the technical areas of work and some of our existing government to government agreements with PEPFAR funds. And we'll hear from more countries as we go. As we noted, we're going to hear more from Zambia and Uganda. But just to note, we have an example here in Zambia of provincial health office agreements in 4 provinces in Zambia that's working on capacity building, mentorship, training, and service delivery, moving into service delivery across a wide range of health areas. In South Africa, we have multiple government to government agreements, but one also with the Department of Social Development at the national level that works on programming for HIV services for young people, 10 to 18, with a focus in Gauteng and KZN provinces. And in Mozambique, we have an agreement with the Central Medical Stores that focuses on supply chain strengthening, commodity systems, pharmaceutical logistics systems, and procurement policies and procedures. Next slide. So I'm going to go into the process and talk through the different steps we have along the way for developing a G2G or government to government agreement. Next. All of our government to government agreements are under our policy guidance called the Automated Directive System, or ADS, Chapter 220. This is a very detailed review of all the pieces that are required for USAID to move forward with a government to government agreement. It's publicly available, and anyone can peruse the language there if you're interested. Next slide. So we've tried to take the language that's in that ADS and simplify it as much as possible into these 6 steps. that we will talk through with you all today. And as we noted at the beginning, this is an overview, and then in future webinars, we will have a chance to really dive deep and talk more in detail on some of these steps along the way. This whole process can take quite some time, depending on the country context and priorities and availability of people for meetings and co-creation. We've seen the whole G2G design process take 2 months, which is very rapid. That was the case for a government-to-government agreement that got up and running quickly in Liberia during the Ebola epidemic. And we've also seen these take quite some time to develop, even up to 2 years, when priorities have shifted or there have been challenges in finalizing documents or coming to agreement on negotiations. Typically, though, the G2G process takes anywhere from 6 months to a year to finalize and get signed and implemented. Next slide. I'm going to start with a brief overview of country eligibility and then turn it over to my colleague Megan, who's going to go through some of the additional steps. So on eligibility, this is really one of the only steps that's an internal USAID action. All of our other steps are done jointly across government partners and is really considered a joint co-creation, co-design process. But this first step is something internally we need to do to make sure we are able to give funds to a partner country government. Since 2019, USAID is required by Congress to review key criteria to ensure we can legally provide assistance directly to a government through a government-to-government agreement. You can see here noted the areas of review that we do. We need to ensure there is necessary capacity. We need to make sure the procurement policies and systems are public and transparent. There must be internal oversight, appropriate internal oversight, transparent public financial management. Budgets must be publicly available. There should be no affiliation with a sanctioned individual organization. And at the end, we need to ensure there is protection of human rights, especially focused on civil and political rights. Next slide. You can see a list of countries that are currently eligible for G2G. This list was, this group of countries was last published in May. Since then, there have been a few additional countries added. To be reviewed, a country mission, USAID mission must request the review to happen. So just because your name, your country isn't on here, it doesn't mean you didn't pass. It may just be that you haven't had a review. Next slide. If you're not on this list and interested in doing government-to-government agreements, the first thing is always to talk to your USAID mission, to express interest, discuss with them if it's a possibility, learn why your country might not be on the list and what you can do to be considered for government-to-government support, and understand if you were reviewed and didn't meet all the criteria, what you might do to address some of those issues to be eligible for future assistance via government-to-government agreement. And in some cases, there are ways to have a waiver to some of the criteria for particular government-to-government agreements, so you can talk to your USAID mission to see if that's a possibility. Next slide. So I'm going to hand it over to Megan, who's going to talk through some of our next steps.
Thanks, Debbie, and very happy to be here together with everyone today and hear from your experiences and share information with each other. So as we get into the process a little bit more in detail, at the beginning part, after we've gone through country eligibility, we really start talking about a consultative process together that may include both formal and informal meetings with our partner government representatives and USAID work at the working level and at higher leadership levels, such as the permanent secretary, for example. Usually USAID will provide a brief presentation on the G2G relationship with our partner government and country, and there will be an opportunity for everyone to share any concerns, questions, and/or other information. And it is important to know at this stage that usually there is no formal decision made in these meetings, but this allows an opportunity for us to provide an overview, talk about questions together, and for our partner government then to go and have more internal discussions to make sure that G2G sounds like the right fit for them. Building relationships and trust is key from the onset of the whole G2G process. Next slide, please. So once our partner government has decided that they wish to pursue the G2G process with USAID, we dive into collaborating and creating the G2G design together. Next slide. Working on the design process is key to success, often done through in-person workshops. During this past year, we do have a few examples where countries have been able to conduct virtual design workshops. And co-design is important to determine the key stakeholders in any G2G agreement, a timeline for implementation, mutual agreement, and understanding on program objectives, and a really great opportunity to leverage our partner government experience and influence and inform activities of the design. Next slide, please. So just to recap again, the co-design process is very key for success in us coming together at the very beginning stages of the G2G process to learn and hear from our partner government. Next slide, please. So we're delighted today now to turn it over to our colleagues in USAID Uganda and the Ugandan government to talk more about the initial co-design process. I am happy to introduce Miriam Range, the USAID Government Agreement Technical Representative in Uganda. Miriam, over to you.
Thank you, Megan. Good afternoon, everyone, and good morning to those in Washington. In March 2020, USAID Uganda signed an agreement with Barra Regional Referral Hospital for one-year pilot to implement HIV service delivery in the regional referral hospital. Barra serves a catchment area of. Okay, can you hear me now?
It's a bit hard, Miriam. Sorry. We can hear you distant. I don't know if it's your mic or. Can you try again?
We can't hear you now. I think you might be muted. We have no sound. Maybe
Down
with
the
your
lower left-hand corner beside your microphone, there's a little arrow that goes up. If you click that, you can select between different microphones and different speakers. Just test each one individually until we get the one that's going to work the best for us.
Can you hear me now?
perfect.
Yes, ma'am, that's much better. Oops.
Okay, so in March 2020, we signed an award with Barra Regional Referral Hospital to implement a one-year pilot activity for delivery of HIV services to over 1,200 people on treatment. So we had a hybrid with both cost reimbursement and fixed amount reimbursement. And I would like to introduce Dr. Barige Celestine, the hospital director from Barra Regional Referral Hospital, and Mr. Peter Okello, the principal hospital administrator. Prior to signing the EELs, we had a series of co-design meetings and negotiations with Government of Uganda counterparts at the Regional Referral Hospital, at the Ministry of Health, and at the Ministry of Finance. So I'll hand it over to Dr. Barige to take us through his experience from his lens of how he perceived the process. Over to you.
Yeah, thank you very much, the organizers, and thanks Miriam for introduction. My name is Dr. Baride Celestine. In the room, I have Mr. Peter Okero Odeke, who is the Principal Hospital Administrator. Then we have Joseph Barikudembe, Coordinator, but also Human Resource Officer. We have Mogisha, who is the Senior Accountant, and Dr. Winnie Mnyidike, who is the Coordinator for HIV/AIDS in Bar Regional Referral Hospital. During the co-design, we went through the whole process as Miriam has just introduced. The team from the USAID mission in Uganda, first of all, introduced this to our ministries, the major ministries. That is Ministry of Health at the top level, the Director General Health Services, the Permanent Secretary. Later on, that was discussed, I think, to include the ministers to be in the limelight. And other ministries, Ministry of Public Service, then Ministry of Finance, because we as Regional Referral Hospital, we operate with those ministries, because Ministry of Finance gives money to referral hospitals directly, not going through any ministry, but also Ministry of Public Service is in, handles the issues of paying of salaries and all that. All those who are the team was able to coordinate with them, and then later on they came to us. When they came to us, in the regional referral hospital, we have the top management. The hospital director is the top manager, or what we call the chief executive. The chief executive meaning that he's the accounting officer, and his role is in two ways. One is actually to look at the accountability of funds that are disbursed to the hospital, and this is done on annual basis by then the Permanent Secretary, Ministry of Finance. Secondly, as the chief executive also, you look at the outputs, like what you put in the budget, what you are supposed to achieve in terms of technical issues. If it is to treat HIV/AIDS patients like the ones we are talking about, they must get the medicines and everything that comes to the hospital. But I don't work alone. That's why I have the team here, and all those were discussed. After making a very discussion, then we also looked at the possible challenges that could be in the whole process, whereby there was a risk mitigation plan. And all that was done in a period of quite, very many weeks. And then we ended up having an agreement that will agree to have this money disbursed to us. Later, we went to the signing of the deal. But I will also allow the Principal Hospital Administrator to elaborate more on the co-design as we continue our discussion. Thank you.
Yeah, thank you very much, Dr. Baride, and thank you very much, all panelists, in relationship to this sharing about our experience with the G2G engagement. Taking on from where Dr. Baride has put it, the engagements involved in the initiation of the process of coming to the G2G arrangement were quite vigorous. One was that we're taken through the process of risk assessment in order to be able to come up with a risk mitigation plan. Indeed, as derived from the previous presentation, this was looking at issues of leadership and governance, This was looking at issues of accountability. This was looking at issues of audits. This was looking at issues of planning. We're looking at issues of transparency, looking at issues, that bring out the position of the hospital in order to be able to manage the finances under the G2G arrangement. I want to say, especially like the process of risk assessment, this is a very necessary, quite committing process, but very necessary in bringing you to the light to appreciate what it takes to make this engagement. Because in it inquires into how has been your previous performance in terms of accountability, where they look at reports of the Auditor General. For example, where the hospital was seen to have not had a qualified opinion in the last 4 years. And I think that was a plus. Looking at the composition of management in order to be able to strategically lead the hospital in this arrangement. We went through that. It took us through who are the partners that we work with and what are their key roles. For example, as director said, there is the mother ministry, that's the Ministry of Health, which is the technical institution that we fall into. And then Ministry of Public Service that is responsible for the human resources. And then Ministry of Finance that is responsible for budget and appropriation of the funds. Now, when you understand what are the interactions among these partners, then you are able to appreciate how the engagement comes. Besides that, the discussion also took us through who are the supporting partners of the activities that we run in the hospital and what are the key roles of each of these. So eventually that was able to frame the engagement on one hand, on the part of the USAID team to appreciate the government of Uganda systems, and then on our side also to appreciate the US government systems. And from that, we're now able to come to agree. By the time we came to what we call the fixed reimbursement as one of the ways of having the money come, and then by the time we came into having the money come in the established government of Uganda procedure of the IFMS, we had gone through the rigorous process and what is involved. And that put us into a position where these funds are clearly coming through the government system, following the government processes and procedures, accounted for in that, and reportable right up to Parliament. I think I first end there and get back to Dr. Barije.
Yeah, thank you very much. So this is what we went through, but to summarize it then is that the whole hallmark or output that we wanted to see was that the US government and the Uganda government systems were able to talk to each other and tailoring it mainly to the processes in our government systems. When, for example, we talk about the disbursement of funds, some of in our country here, we have mechanisms. We go through the budgeting system, which really lasts for about 9 months, maybe about 7 months. That is from September to middle of April. Now, when you look at the planning process, there is what we call the release of the cash limits. And then these cash limits are given to us early. We think about them as an entity, as some small departments. We understand what we are going to do in the next financial year. And then as we plan using those cash limits, we also share all the plans like a budget framework paper with the stakeholders of the hospital, which the supreme body of the hospital, which is the board, we present our plans to them and we agree that the hospital is going to do A, B, C, and D, and the board approves that. Now, even before the board approves, in some instances, you also know that we have what we call budget conferences, whereby we also present to the wider stakeholders, including religious leaders, politicians and other partners, implementing partners. So after that, then when we get the views of these people with those indicative planning figures, then we agree that yes, next financial year we're going to do this and these activities. Now, then we go to step number 2, whereby we have to present this budget to the member of the the 3 arms of government. That is the parliament. We have what we call the Health Committee of Parliament. We present there, and our Minister of Health is the one who leads the whole departments of the health. And we, as a regional referral hospital, we go there and present what came from our discussion, our consultations. We present directly to Parliament, and then the committee will agree or will change something, or like they have their input. And then later on, the budget is taken to Parliament as a ministerial policy statement approved in April, and that becomes the budget for the financial year. Our financial years in Uganda, they begin 1st July of every year. Like our next financial year is 1st July 2021, then 2022. Now, having said that and brought you in perspective, is that we looked at the USAID team came and we narrated all this. So we told them that if you want to give us money, then you tell us how much in advance, so that we plan for it and we know how much on which areas. And that is what they went and did, and that was done. Now, then on the other side, of course, at that time when they came, the budget had been passed, but we had to use the option B of how you access money. That is by use of the supplementary funding. Supplementary means that when you bring money right now, when the budget is already approved, our constitution and we also have what we call Public Finance Management Act, an act of parliament, will give a leeway for you to be able to access this money. And then, of course, you also have to present a budget, but not through all those processes I've described earlier, but some shorter processes. And that is how this money was given to us. Now, when it came to us, and then we have to go through the warranting system. Warranting system is through the means of finance, whereby the office of the accountant general, we have in means of finance, we have 2 arms. We have the planning, and we have also the financing area. The planning looks at the budget, then the accountant general looks at the disbursement of funds, so that those 2 offices were coordinated properly, and the money was agreed by the budget area and sent to the accountant general, who also signed and agreed to put it on our system, which is called Integrated Financial Management System. This is a system whereby funding from the central bank, the Bank of Uganda, will come directly to your account in the hospital. But before it comes, you have to show that that activity is ready to be done, and it has sometimes maybe it has been done, and all the reports are there. And then when you send the prompt, then the money is paid directly. So we actually don't touch the money directly like it's kept in our commercial banks. No, it comes from the central bank to the beneficiaries of someone who has done the activity. Similarly, even salaries are paid like that. And this was done to make sure that there's transparency in whatever you do, there's accountability, and also to avoid fraud in government institutions. Now, at the end of all that, every year we are subjected to a very big audit. This audit is called the Auditor General's Office, and this Auditor General makes sure that what you plan to do, you did it. They come on the ground, they check everything, and the report is produced. Now, if you are found okay, then you continue to operate. Thank you very much. Back to you.
Thank you so much. Miriam, do you want to close?
Peter, do you have anything else on co-design process, developing the milestones, the budget, and all the other attachments, the project description. Do you have any comment on the interactive process? In 1 minute, please.
Maybe, Miriam, you need to be speaking a bit louder.
Hello, Miriam. Miriam, maybe you repeat it a bit. You're a bit low. Miriam.
Can you hear me now?
I wish you like that. That is very better.
So Peter, do you have a minute to talk about the development of the milestones, the budgets, the program descriptions, the process that we went through? I know it was pre-COVID, but we've had some amendments since then, and it's been part of the co-design and the negotiation process. In 1 minute, please, Peter.
Thank you very much, Miriam. In short, like I said, it was a rigorous process. We had a series of meetings right from the hospital, gotten down to the G2G team with the partner that's right. And then also we had to get into closed sessions where we're going through each particular area and sharing on what is involved. The whole process was really very interactive. That is the beginning point. And there was a lot of transparency in sharing, because that is what was able to bring out and enable us identify where there are gaps, where there is the strength, and now to bring in both the two teams to understand how the government works, how the hospital works, and how then the G2G fits within. That also gave us a possibility, that gave us an opportunity to be able to negotiate on certain areas, especially on the funding mechanisms, because we went through and tried to sieve out which is the best that fits into the needs and the requirements of government of Uganda and then the government of America under the USAID G2G arrangement. Thank you.
And for the team in Mbara, could you put on your video for a minute just so we can see you all? It's great to see the whole team in the boardroom in the regional referral hospital.
We can, but I think the host has muted the video. Okay, start the video.
Great, thank you.
As that is being done, something else I can add is that a specific code was developed and guided as issued by Ministry of Finance, where in the budgeting and in the reporting process, these funds will specifically be reflected. They are not hidden out from the whole system. So we are able to see what activities were able to be done, how much money was allocated to it, and how much has been spent.
Yeah, you can, the moderator can start our video, it is on. Yeah, then you should be able to see us.
Yes, we can see you. That's wonderful.
Are we still on, or our minutes are finished?
Yes, thank you so much for such great insights into not only the co-design process, but also the risk and capacity assessment process. I see that we have one hand raised from our attendees. Abdul, we have time for one quick question. If you would like to speak now, I'm going to or Jeff, can you help me to take him off?
Yes, he's able to speak if he unmutes himself.
Okay. Hi, Abdul. looks like you might still be muted. I'm trying to ask you to unmute to speak. Hi, Abdul.
Hello? Hello, hello.
Hi, we can hear you great. Thanks for
Hi,
joining us.
hi. How's it?
It's good. Thank you for being with us today. And we are excited to hear what your question or thought that you would like to share with the group today.
No, this moment I have not question.
Okay. Sorry about that. I think we saw
Okay.
your hand raised, so
Okay.
we thought that you had a question. So we will move on to the next section, which thank you again for colleagues in Uganda and also the government of Uganda for already articulating a bit of this section. As was shared, usually during the co-design process, we're also in parallel working on the risk and capacity assessment process, of course, jointly with our partner government and USAID working together. And USAID will work with our partner government to determine which risk categories are mandatory for an assessment, such as budget, procurement, human resources, governance, and others that are listed on the slide here. It is also worth noting as well that there may be other assessments not listed here that may be required, such as an expanded democracy, rights, and governance review, if applicable, gender analysis, and/or also an initial environmental examination. Next slide. Okay, thank you. And here we want to highlight the methodology of the G2G risk and capacity assessment as an overview of how we work together to complete this process. This includes different teams from USAID coming together, such as our finance team, technical team, and possibly our democracy and governance colleagues also participating in the assessment process. Very similar for our partner government entity, a variety of teams or different departments or divisions, both at the subnational level and at the central or national level, such as Ministry of Finance or Ministry of Health, will come together to participate in the assessment process. And usually this process can take anywhere between 2 to 6 weeks after initial consultations. Virtual risk assessments are possible. Yes, it is a little bit more challenging, but of course, especially during COVID times when we want to prioritize the safety and wellness of everyone as a top priority, virtual risk assessments have been possible during this time period. Next slide, please. So what is the outcome of this assessment process? The outcome usually results in a risk log or matrix, a risk assessment report, and a risk and capacity plan. And all findings for all of these results or deliverables and all these documents are shared with our partner government and USAID for much discussion and feedback, editing and revising, and really to emphasize the joint assessment process that we work on together. And here in the slide, you just see some examples of these different deliverables or results. Next slide, please. So I know we've heard a lot already from the government of Uganda about this process, but I do want to hand it over to Rina Mukasa, our USAID Uganda Deputy Controller, to see if maybe you have anything to add, Rina.
Thank you, Megan. Good afternoon and good morning to those in different places of the globe. Yes, just to add to the Uganda, in addition to what you've said, I would just like to raise something regarding the risk assessment of specifically Mbarara Regional Referral Hospital. It was a very collaborative effort as the PHA, the hospital administrator, has indicated. We did the assessment mainly as a USAID in-house team, unlike what we currently do virtually. You've mentioned two approaches: the on-site assessment that is performed by USAID or contractors, and also instances where the assessment may be carried out virtually. In this particular case, the assessment happened in 2019, and it was purely done by USAID team. We were on the ground in Mbarara for quite some weeks, as Mr. Odeke indicated, and the process obviously involves interviews with different stakeholders at the hospital, at the district, with the Ministry of Health counterparts that are required during to complete the process, as well as Ministry of Finance. Engagement mainly at the central level was to corroborate some of the information we had established while in the field. And in all these discussions, the Mbarara team was involved to ensure that discussions are closed with all stakeholders, and that everybody who needs to be at the table when we are making decisions that would inform the results of the assessment, as well as the approach of developing corrective actions in the risk mitigation plan. All parties were involved in these discussions. And yes, and I wish to emphasize that because these two pilots were our first risk assessments, we did use the entire framework, the PFMRAF tool or questionnaire, the way it's structured in its entirety, just to provide learning for USAID, because like I said, these were the first risk assessments that we were performing, and we wanted to be as familiar with the tool as possible, but to also use it as an opportunity to learn the government of Uganda systems better. So subsequent assessments, we've actually scaled back on the scope. That's all I would state on that. I'm not sure if the Mbarara team needs to add anything to the risk assessment that we carried out with them. Thank you very much, Megan.
Wonderful. Thank you again for your wealth of knowledge and experience, and congratulations to you all for all the fabulous work that you have done in the past and you continue to do to move G2G forward in a partnership in Uganda. So our next slide, please. So we're moving along in the G2G journey together, partner government and USAID hand in hand, and we're diving into the negotiation and signing phase. And this part of the process highlights how G2G agreement milestones, activities, and payment structures are discussed and negotiated among USAID and our partner government. And we work together to finalize the risk mitigation and capacity development plans, milestone reimbursement verification forms that are included as attachments to the agreement, and other topics such as monitoring and evaluation, reporting, and climate risk management. Next slide. And here we wanted to provide a snapshot of what does the milestone table look like. Most agreements include milestone tables as an attachment to the agreement itself, and it really combines all of the hard effort that we've gone into collecting all of the information to design our milestones and our activities together, along with the payment structure. Next slide. There are many different, I would say, mini stages or smaller stages of the negotiation process, with lots of back and forth and sharing of documentation and discussion to build milestones together and activities that lead up to achieving those milestones, as well as associated payment amounts for each of the milestones for a G2G agreement. Again, emphasizing the importance of trust, transparency, and accountability of USAID and our partner government in working together. And while this process can take some weeks, it is essential for both parties to really be on the same page for expectations for the agreement to be successful. This also includes articulating and agreeing on milestone targets and baselines, and also clear completion dates. Next slide. And now, after at least 3 to 6 months of a joint design and assessment process, with maybe a few frustrations, but many fun memories together, our host country government and USAID are ready to sign this G2G agreement. The agreement is first signed by USAID, the mission director, and then by our partner government. And occasionally, when possible, for in-person meetings, we often co-host in the field a code signing ceremony, which is often attended by the US government ambassador in country. Often for USAID, the signing process does take a little bit longer than perhaps our partner governments, sometimes between 15 days to a couple of months. And that's because we have many different teams and departments within USAID at the mission that will be reviewing the final agreement before our mission director will sign. Thanks everyone for today. Happy to have you on board and participate in our webinars and in the discussion. And I'm handing it over to Debbie now.
Thanks, Megan. Next slide. We just have one more phase to talk about and then hear from our counterparts in Zambia. So the last stage is the implementation and monitoring and evaluation. Next slide. It's key to have good communication and coordination. I think you've heard that theme hopefully throughout, that this is really a joint process. So we need to make sure that the communication works well. After signing, both USAID and our government partner will assign a point of contact for USAID. That person is called a Government Agreement Technical Representative, or GATAR is the acronym we use. You already heard from Miriam, the GATAR in Uganda. And the teams, both from USAID and partner government, will come together in a kickoff meeting, which is an opportunity to re-review the award and begin planning for the work plan and implementation. Next slide. Part of implementation, of course, is payments and that review process of the payments. So this is an example of the form, a standard form 1034 that is used to trigger liquidation or reimbursement for milestones that have been achieved or cost incurred. This form goes to USAID, to a voucher examiner, who then shares that with the government agreement technical representative, who reviews that along with verification forms for the achievements or costs. Next slide. Here is an example also of a verification form from Zambia. You'll see on the right side. These are used to track milestones that have been achieved. And we wanted to note that advances are allowed as well under a government-to-government agreement. And if there is a milestone that is unmet, in some cases, payments can still be made based on partial completion of milestones, but all of this must be agreed upon ahead of the signing, and language needs to be included in the agreement to make sure that this is approved by all parties. In some extreme circumstances too, the milestones or activities can be renegotiated. There may be extenuating circumstances such as COVID or other kinds of events that have happened that would necessitate renegotiation of an award. And that can happen throughout the implementation period of the government-to-government agreement. So there is some flexibility in these even after signing. Next slide. Here is an illustrative timeline for implementation of a PEPFAR government-to-government agreement. We just wanted to note that you can see the milestone verification can happen periodically, either monthly or quarterly, depending on the agreement throughout the cycle of the award. And that we've noted here, our US government fiscal year is October 1st to September 30th. That's the same as our PEPFAR country operational plan year or PEPFAR activity implementation, but we recognize that sometimes that is not in alignment with a host country government fiscal year. So part of the conversation and discussion in the early phases is understanding when to start and what fiscal year to align the work to. Next slide. I want to make sure we have time to hear from our colleagues in Zambia. So I will turn it over to Dr. Matthew Ngambi from USAID Zambia to introduce our colleague in the Copperbelt Provincial Health Office. Over to you, Matthew.
Thank you, Debbie. Good morning, good afternoon, good evening, everybody. So Zambia, you may know Zambia is in its third year of implementation of the G2G mechanisms. We have agreements in 4 provinces at the provincial office level. And through these 4 agreements in those 4 provinces, we are supporting approximately 42 district health offices, as well as various hospitals. Dr. Robert Zulu is the Provincial Health Director for the Copperbelt province, in which province we are implementing this mechanism. And with him, I think we will share on this presentation the steep learning steps that we have undertaken together in implementing the G2G mechanisms. So please, Dr. Zulu, you are welcome.
Thank you, Matthew. Thank you, Debbie. It's a pleasure for me to present our experiences on this G2G mechanism. With me in the province, I'm joined by the Human Resource Development Officer, Mrs. Chota. I'm also joined by the Senior Accountant, Mr. Msonda, and the planner, Ms. Nkazana. I think for us in the province, under the Ministry of Health, we have benefited a lot under this mechanism. I want to take this opportunity to thank the USA government for the support that they've given us to implement various programs under this program or mechanism. Let me just share a few experiences under the FAR and the CR arms of the G2G mechanism. As stated earlier on, the CR basically is the cost reimbursement, and the FAR refers to the fixed amount reimbursement agreement. The cost reimbursement basically refers to the actual cost that we have incurred during the implementation of a particular program that is reimbursed. Whilst the FAR refers to advances that are given to us depending on the results of a particular activity that we are undertaking. Let me state that as a province, Copperbelt, we actually second to Lusaka. Lusaka has the highest population. Copperbelt is the second biggest in terms of population. And what happens on the Copperbelt basically has implications to what happens in the whole country because of the population dynamics. Now, under this G2G mechanism, we have seen as a province a lot of strides. Let me talk about the HIV programs that we've been undertaking in the province. We've seen improvement in the outcomes of the 90-90-90, which the country has been pursuing. In the province, we have raised the target to 95-95-95 because we thought that with this support from the USAID, we should be able to move the milestones under the 90-90-90 to a higher level. And I should state here that by the end of 2020, with support of G2G, we've been able to reach our provincial targets of 95-95-95. And we have contributed to the country's 90-90 because basically if we have moved our targets higher than the 90-90-90, we have actually moved the national targets and the national targets did, the the country did reach the 90-90-90 at the end of 2020. We think that Copper Belt did contribute, and we know that the G2G support that we had from USAID did help us to reach the various arms of the 90-90-90. We think that it's a good support, and it's a good mechanism to help a country reach the HIV targets that a country has reached. Because we would not have had support, this extra support, the government grant would not have managed to help us reach the various targets that we had set aside. The TB, tuberculosis targets that we had set for ourselves, in fact, Copper Belt was the highest in terms of the cure rates for the nation. At the end of 2020, we were able to reach targets of 92-93% of cure rates for tuberculosis. Tuberculosis is a big problem in the province because of the nature of the industries which are going on in the province. I think of the provinces, Copper Belt has the highest number of TB patients and people that are burdened with tuberculosis. But we've been able to reach targets that have helped us to cure our patients with TB above the national targets, which are 90, and we managed to reach 92%. With the support of G2G, we've been able to do a lot of capacity building under nutrition. Nutrition is a challenge. Although Copper Belt, most of the towns on the Copper Belt or in the province are urban, but we do have 3 districts which are rural, and the support of G2G has been able to help us mentor our community-based volunteers to be able to support our mothers in the community to give nutrition, the proper nutrition to our communities. So the G2G mechanism help us to build capacity. The community volunteers who are working in the community 80% of the time have been given this capacity to support our communities in the area of nutrition. Mother and child health has been a big challenge in the province. In fact, in the country, maternal health, child health, these two have been a big challenge. G2G mechanism has helped us to support the blood bank in the provision of blood, which is a very essential commodity in maternal health. After cesarean section or post-delivery, postpartum hemorrhage, and all the complications that have to do with maternal health, blood is a big component, a very important component in achieving or reducing maternal mortality. And the G2G mechanism, I should state here that with the support to the blood bank, we've been able to move strides in that area. And I should state that the training of our healthcare workers in IMOC to be able to give them capacity to manage our mothers that are expecting, or they are delivering, or they have delivered. This has built capacity in our nurses, our clinical officers, and even our doctors in short courses of managing women that either have complications of childbirth or they have complications of pregnancy. And IMOC has been a key course in helping us move our indicators in the right direction under this. There are a lot of lessons that we've learned under the G2G mechanism. We've learned to mitigate all the risks that we're undertaking, because each program has got its own risk. And the strictness of the G2G mechanism in making sure that these programs are anchored and you put on mechanisms to prevent various problems that go with reimbursement of funds and movements of funds from one area to the other area. Our internal auditors have been on top of the game to make sure that not only the G2G funds, but also the government funds which have been coming to us, the capacity and the knowledge that we've gained in mitigating risks has been overwhelming. I want to take this opportunity to thank the USA government for that capacity that we've gained in mitigating risks. The extra knowledge that we've gained and the letter of implementation that we've gained, that we are given at the beginning of the program, we've learned that it's very important to understand that letter. Because if you follow it letter to letter, step by step, it will be easy for you to be able to implement the G2G mechanism without a lot of problems. We've also learned to work with other ministries, in particular the Ministry of Finance, who are handling the resources, who are recipients of the funds. Sometimes there are delays, but engagement with the Ministry of Finance has also helped us to be able to engage these ministries, which are experts, the ministry which are experts in handling resources, government resource or donor resources. So we've been able to, to build bridges with such ministries. So the G2G mechanism is a mechanism that we think has helped us move our health indicators in the right direction. I want to commend it, and I want to look forward to working with the USA government through this mechanism to be able to move our indicators to what we have set for ourselves as Copper Belt province to 100%, 100%, and 100%. The three arms of HIV, we hope that we should be able to reach targets which are above 95 by the end of 2021. With this support, we think we should be able to reach those higher targets. I thank you.
Thank you so much, Dr. Zulu. Matthew, anything in closing?
No, just to say maybe that, what we have learned, some of the things that we've learned very quickly is we needed to start implementing activities that were fairly simply designed. So we did a lot of simple activities, trainings, mentorship, and quite light on service delivery activities. We are moving effective in the coming year. I think we are taking up quite heavy lift of direct service delivery activities. So yeah, it's an exciting time to be in. Thank you, Debbie.
Thank you, and thank you so much to Dr. Zulu for sharing really clear lessons learned and points. I had the opportunity to visit Ndola and the Copper Belt Provincial Health Office a few years back and heard from Dr. Zulu there too. I was so impressed about all the learnings, and hopefully we'll get you to share again in another series. There's so much from all countries to hear about. So last few slides we have before we'll address some of the questions. We just wanted to share some resources. The next slide. We have, as we noted, 4 more sessions in this webinar series on government to government agreements. We have one on co-creation and design. So we heard a little bit about that from Uganda, but as you heard, there's so much more to hear and learn about. So we have a focused session on that. We have another whole session on risk and capacity assessment and mitigation, negotiation and signing, and the implementation and monitoring and valuation. These will happen over the next few months. You see dates proposed on the side. Please let us know also if you have other suggestions for topics that you'd love to focus on, or there's other information you'd like to learn about. We've noted a couple resources as well in the slides. These are links, so you'll be able, once you get the slides, to click on those and go to these documents. And of course, always reach out to your USAID mission with any particular questions about the G2G process or your country work. We'll go to the next slide. We just wanted to address some of the questions in our chat box. And you'll see the poll coming up already to respond to. But while you're doing that, I will first take the question in the Q&A box about what is the process and documents required for an amendment of a government-to-government agreement. And I'll ask if Matthew from USAID Zambia could get back on microphone and respond to this, because I know you all have done this in Zambia.
Thanks, Debbie. So in the last 2 years, we've had a few requests for modifications to the G2G agreements. But generally, as a mission, I'm very quick to say that the mission does not encourage modifications to the G2G mechanisms. I think that without modifications, we are going to be more supportive in terms of strengthening the partner government systems as well. So it's not something that we take very lightly. But even if it's not encouraged, at times circumstances are unavoidable that we need to kind of, look at the possibility for making these modifications. At times, I think one of the biggest challenges that has made us consider modifications is delays with implementation for many reasons. And most of the times the delays are because the provincial health officers are also receiving their fundings from the Ministry of Finance very late. We release funds, but they get and affect the rate at which these activities are going to be implemented. So I think that as you think of modifications, there are many considerations. In terms of the milestones themselves, we almost never will allow for modifications to kind of the targets that are set in the milestones. What we do consider maybe extensions in terms of the time that this milestone will be implemented at. And again, it starts with the GATA, working with the provincial health office, discussing this request and submitting a request to the mission G2G team, this request for consideration for that modification. And they need to give quite good justification for that. So what is submitted to the front office through this G2G team is really like the new modified implementation letter. So for purposes of clearance, it is actually approved at the mission level by the mission director and then submitted to the host government also for the approver to append that. So for Zambia, for instance, it's also approved at the Ministry of Finance by the permanent secretary there. So this is kind of the process that we've gone through. Thanks.
Thank you, Matthew. We had one other question about strategies to be used during COVID-19. We recognize that the in-person government-to-government planning is so critical and a foundation for building the relationships and trust. So how have some of the missions dealt with and different country partners dealt with this planning during COVID? Are there any strategies? I wonder if Miriam or Rena, if you are still on, if you could address this, or Matthew, or any others, please raise your hand if you have suggestions. I know some countries have done virtual calls and interviews for risk assessments and followed up with very limited in-person meetings to gather documents. But I'll defer to Rena or Miriam first if you have any suggestions.
So during the COVID period, we've had risk assessments carried out on 2 additional regional referral hospitals. And because of the restricted movement by the mission, we engaged CPF firms that were able to go to the field and perform on-site meetings. All the meetings, USAID participated in all the interviews and participated virtually. And therefore, most of the work that the CPF firm had to do was reviewing documents. That was a piece we were unable to do, but they would load, we were using a Google folder where they could load the documents. So I could say our level of effort was as close to what we normally do when we are able to go to the field ourselves, because we worked all the time. We participated in all the activities with the CPF firms for the entire period of the field work.
Thank you.
And of course, the challenge is connectivity. The connectivity was really a difficult matter to deal with because different locations experience the internet connections in different ways. So it was a lot of touch and go in the first 2 days until we identified a mechanism that would work best for the team in Kampala, and then the CPA farm and the hospitals out in the countryside.
Thank you, Rena. Yeah, that piece on technology can be so critical during COVID when we really often are relying on virtual meetings and virtual connections. Any thoughts, Matthew, from Zambia on strategies during COVID?
So not so much anything different, and maybe not just about planning, but for instance, in Zambia, we've had to figure out how um, to do verifications for purposes of milestone, liquidations and things like that, to do verifications virtually. So again, making use of even our partners who are, because the restriction on travel is quite effective in Zambia, and it's affected the way we would generally like to work. I think that what we have practically seen is kind of, it's affected our relationships with the provincial health officers. I think also appreciating that for them, they are working in person, completely in person. So a lot of times you get that impression that, it's not easy for them to understand why you can't be there. So we've had to have a lot of engagements, but we are also very grateful that I think technology comes in at play. Just being sure that maybe on a weekly basis, we are attending their management meetings virtually, and they know that we are there. We are very responsive to requests that they have. So it's really just how well we have been able to utilize the technologies, as well as utilize the presence of our IPs in the facilities where we want to undertake some of these verifications or site visits and things like that. Thanks, Deb.
Thank you, Matthew. Any comments on those questions from Dr. Zulu or the team in Mbara Regional Referral Hospital?
Hello, this is Michael. Can I go ahead?
Sure.
Okay, so this is Michael Fiajiba. I'm from the Ghana Mission, the program office, and I am the G2G specialist for the mission. So yes, I agree with almost everything that has been said by my colleagues in there. And what I can add on in terms of communication and how COVID is impacting on activity, the key thing is communication. So early and frequent communication between the mission and the implementing partner through the GATA, the activity manager, is key. Usually, the implementation letter spells out conditions under which the implementing partner can come to the mission for some review in terms of extension of the period of performance. So it is very important that we engage with our implementing partners to know that we are in the boat together, and that what affects them affects us also. And so it is important that we communicate to them regularly, let them know that if they have any challenge, they should route it through the activity manager. The mission will review it and then give them a feedback. And so, for example, in our mission, we did that with a couple of our G2Gs, and we had to extend it period of performance for some time. They came back to us and told us that this is the challenges that they are facing. So it is very important. I'll touch briefly on an earlier point that was made on what are the documentation and the processes involved in amendments. And usually in the implementation letter, it spells out the conditions under which an ill can be amended, and it's broad enough. So the documentation that goes with it is that the implementing partner should officially communicate to the mission through the GATA, that these are the challenges I'm facing, and per these challenges, I think that we need to extend the period of performance, and then that becomes the reference point to amend the ill, and then you add the necessary documentations. If there are previous amendments that were done, you add them to the clearance process, and you need to add your ANA data sheet, including the official communication requesting for an extension, and it goes through the clearance process. And those ones, my other colleagues have mentioned that already. So I think that this is a great opportunity for us to, as a mission, to elevate G2G and get our implementing partners, like my other colleagues have said, strengthen their capacity to be able to implement the activities whilst we sit back, observe, and then effectively collaborate with them. Over.
Thank you. Great points. And I think hearing all these questions and observations about COVID, it makes me think in every one of these sessions, we should really focus on adaptations and how we have tailored the process in this current context of COVID-19, which is obviously impacting all of us in many, many ways. Any last questions? I see one in the chat box or in the Q&A box on training package components for auditors for G2G activities or projects. And do we have any of these training opportunities? So we do, through our ASAP project, have a public financial management course online. I am not aware of any particular training for auditors for government to government agreements, like that very focused type of training. But I know we are in the midst at USAID in thinking through new training opportunities and new needs we have for our government to government agreements. So that can be one that we bring back and discuss and see if there's any opportunities for developing those trainings. I will also explore if anyone else at our headquarters or in the field knows of other trainings out there for auditors of government to government activities. I see a hand raised. If we can unmute. Go ahead, Michael. I think you.
Yes, thank you very much, Deborah. So yes, there are no trainings for auditors. However, each mission can work with their respective finance office to sort of have a special arrangement with either USAID regional financial office to have some auditors within their host government institution train. And I'm speaking this from the fact that USAID Ghana did something similar, and we have a very good relationship with the Supreme Audit Institution in Ghana, where they have been trained in terms of knowing what USAID needs are and what are the best practices when it comes to audit and reporting. And so that relationship has strengthened the the Supreme Audit Institution of Ghana. And over the years, they have been auditing our G2G activities as part of their official Government of Ghana audit. So you can work with your regional financial management office to look at specific needs that will address particular host country auditors and how it will also address your audit requirements. Over.
Thank you for that. And I think in our session on implementation and monitoring and evaluation, it sounds like it would be great to also make sure we cover the audit piece, as it's a critical component of implementation. So thanks for sharing those resources, Michael, and your experiences in Ghana. I know you all have had a lot of government to government agreement experience and lessons to share. I am not seeing any other questions or hands up. Let me just look.
There's one hand up from Rena Mukasa.
Oh, go ahead, Rena. Yes.
In addition to what Michael has said, we've also found it useful to provide CPA firms prompt feedback throughout the process to ensure that they are on track with expectations. Risk assessments are quite unique assignments, and not all CPA firms will have the right experience to execute these assignments. But providing prompt feedback has helped us in a number of assignments that we've engaged with them. So not to wait until the end of the assignment, but to have check-ins during the course of the assignment to correct things as they fall off the rail.
Great. Thank you all. We are at time, and we really appreciate everyone's engagement, questions, and listening to this first session. We gave you a lot of information, and we know it can be very detailed. There are a lot of acronyms we use and special lingo and language for our government-to-government agreements. We hope this provided an overview. And as we've noted, we will then go into detail on these steps and really talk through what's required and hear more from colleagues across our government-to-government programs. So thank you so much. And we really appreciate your participation. Please let us know your feedback in the poll, and we look forward to talking to you again in a few weeks on our next government-to-government webinar session. Thank you all.
Thank you.
Thank you. Thank you. Have a good day.
Thanks,
Thank
guys.
you.
Bye-bye. Celestine, bye-bye. Good to